Okay, inshallah, let's begin. Bismillah ar-Rahman ar-Rahim. الحمد لله نستعينه ونستغفره ونعوذ بالله من شرور أنفسنا ومن سيئات أعمالنا من يهده الله فلا مضل له ومن يضلله فلا هادي له ونشهد أن لا إله إلا الله ونشهد أن سيدنا مولانا محمدا عبده ورسوله صلى الله تعالى آله وأصحابه وسلم تسليما كثيرا كثيرا. السلام عليكم ورحمة الله وبركاته. Welcome to the Balagh series of lectures and webinars on the coronavirus pandemic and Islamic guidelines. So this is quite a special session because there's been a lot of sort of feedback that we've had from yourselves, the audience, in terms of wanting something, some clarity on the issues of Islamic perspectives on funerals, burials, janazah, and so forth. So on that basis, what we've done is we've collated some expert opinion. So we have a number of people with us today. These people are quite familiar. So they've been already present in previous webinars. So we have with us Shaykh Yunus Dudhwala. And if you all recognize Shaykh Yunus Dudhwala, he's the head of chaplaincy at Barts Health NHS Trust. So Shaykh Yunus is very involved in a lot of these issues, more so down south. In England, recognizing that we've got an audience from all over the world here. It's not just the UK audience. We also have Mufti Zubair Butt, who many people recognize. He's known for his fatwa on organ transplantation, and he is also the chair of Al-Qalam in the UK, and he's quite heavily involved in some of the issues from the Sharia perspective to some of the areas around burial and funerals and various other things. Then we have with us Brother Mohammed Omer, who's the chair of the National Burial Council, UK. So he's a very pivotal person today because he can give us a lot of insight in terms of the work of National Burial Council and the conclusions that they've drawn, give us some kind of clarity in terms of some of these really important issues that we need to be dealing with. We have another panelist who unfortunately is not here at the moment, but inshallah when he joins on we can approach him and discuss a couple of things with him then. So that is Dr. Muhammad Munir. So I'll introduce him even before he's here, who is the virologist from Lancaster University, somebody who's getting recognized quite internationally, has appeared on a lot of prime time sort of TV shows and talked about COVID-19 and all the sort of different issues, medicals and science issues related to it. Okay, so let's begin. And first of all, let me just mention one or two things before we begin. Now, there are some very, very sensitive issues in relation to how we are dealing currently with some of the deaths that are occurring as a result of COVID-19. There are a lot of fatwa out there. There are many different sort of guidelines that are being passed through here and there from many, many different groups of people. And one thing that it is causing, so people are telling me, is that it's causing some element of confusion. The confusion lies on the basis of, first and primarily, the fact that this is a very serious issue. Somebody who's quite beloved to you, who has passed away. How do we deal with that individual? How do we do the ghusl? How do we do the kafan? How do we read the janazah? And what is the issue related to ta'ziyat and various other things. So there's a number of different issues that need to be discussed. And our objective today is to introduce and bring some serious clarity on some of the most up-to-date knowledge that we have from some of the public health bodies, as well as sort of some of the science that's behind it, inshallah. So let me start off first with Shaykh Yunus. If you can give us some kind of insight. What is the current situation with Muslim deaths? Okay, so that have been confirmed to be COVID-19. What is the issue at the moment? Where are we with things at this present moment in time?
Bismillahir Rahmanir Rahim. So obviously it's a very difficult time for everyone, and there's lots of challenges in different areas. One of the areas that we are finding challenge is where the families are not allowed to go and see their loved one. Sometimes loved ones are dying alone. So that in itself is a very, very big challenge. Moving on to the next stage, after the person has died, There's issues of whether to do whether we can do ghusl or we can't do ghusl. Just to mention a few changes that have happened in the past week or 10 days in the UK. Previously, what used to happen is that the death certificate used to be issued to the family, and once the family had received the death certificate, they would go to the register office, they would receive the green form for burial, and that would allow them to do the ghusl and the burial and collect their loved ones. What has happened in the last 10 days is the legislation has changed because they do not want families to come in because they could be COVID-19 and they might pass on some of the, if they are COVID-19 positive, they could put others at risk. So the legislation has changed. The families do not have to go into the hospital to collect the death certificate. The bereavement office will facilitate that and let the family know that this is where the certificate is, this is how the certificate is being issued. This is what's written on the certificate. They will take the details of the family. And then once the family has received the death, they will not receive the death certificate. The death certificate will be written and sent by email, scanned directly to the register office. The register office will then contact the family. They will find out who their funeral director is. They will find out which cemetery they're going to use. And again, the family will not be called into the office. They will take the email of the cemetery or the funeral director and scan that green form and send it to the funeral director or the cemetery. So that's the paperwork out of the way. Then we have the issue around picking up the bodies and then doing the ghusl. And as you mentioned...
Can I just pause you there for a short while, because there's quite a lot of information you've given there. Now, for somebody who's a GP from my end, there's been quite a few changes as well, and I'll sort of mention some of those changes. But generally speaking, okay, so in essence, you mentioned something about the funeral services. So will the funeral services be allocated? Or you have a choice in terms of the funeral services that you can use?
The family have a choice.
The family do have a choice, right?
Family do have a choice,
right?
Depending on which funeral services are facilitating COVID-19 disease.
Right.
Some who have been actively doing COVID-19, doing funerals for many years, have decided not to touch COVID-19 because they feel that they do not have the correct PPE, or they do not have personal protective equipment, or they do not have the facilities to deal with the deceased patient from COVID-19. And that's fine. But there are still some, and that's why I think one of the things that we're going to encourage today is that towns and cities need to come together and create hubs, 1, 2 places, 3 places, 4 places, where the facilities are good, where the funeral directors are well trained, where other people are well trained, and they will be able to facilitate the funeral services as per normal.
Okay. Now, that's clear. So this is about COVID confirmed patients. Now, it's actually having an impact on other patients as well. So let me give you another perspective. So from my perspective as a GP, we have instances where people who may be quite old and they're in a situation where they may be end of life, possibly, or it could be that they have quite a serious condition, and they've been, in essence, I mean, I'm in the process at the moment working locally in Bradford, and they're actually looking at developing letters that go out to the communities, specifically identifying patients who are the highest risk end, who are frail, vulnerable, where hospital admission would actually be very problematic for them. In fact, it would cause more issues. So even those kind of individuals, they've been told to ideally stay at home and the care to be provided for them around their home. Now, the issues that arise there, again, is some of these patients are going to die, or they are in the process of going through palliative care at the present moment in time. And as clinicians, we've been advised that we do either video consultations so that we've got some kind of understanding about there's some kind of understanding that these individuals are either palliative, so we know that they are end of life and various other things. So we're doing video consultations with them, or we're actually talking to them over the phone. And that has changed quite considerably, because now as doctors, you don't have to actually see the patient. You can just have some kind of record of the fact that they've deteriorated, the end of life, and that will be accepted by the coroner. So you can already see there's a real change in the system in response to COVID-19. So as a result of that, that's going to have a real impact in terms of the kind of care that these people are going to receive towards the end of life, which is something that you clearly reiterated. Now, there's something about patients who are dying in the hospital that people seem to be focusing on, but rather there's a lot of people that are expected to die even at home. And this is something else that needs to be elaborated on and talked about. Okay, what I'm going to do is, let me just move on to Muhammad Omer. You're the chair of the National Burial Council. So can you give us some kind of update about what the National Burial Council, what do you do? What's your role? What does the National Burial Council do? Let me just
unmute me. Okay.
Yeah,
Okay. Okay. Bismillah ar-Rahman ar-Rahim. Assalamu alaikum wa rahmatullahi wa barakatuh. The National Burial Council was really set up about four years ago to try and bring everybody who is in the funeral and end-of-life care industry together so that we can share best practice. If we have to lobby the government, we can do that. And then also work together as one body so that we can then give true guidance to the Ummah in terms of burials and funeral services. So that was the main purpose.
You have members. There's like a board.
No, it's not. It's a board. It's a voluntary organization. Right. It's an umbrella body. That's the right word. It's an umbrella body.
The reason why I'm saying this is because, like I said before, we've got a lot of people from all over the world here.
Correct. Yes.
On this webinar. So right. The model that you have,
yes,
might be very specific for them and something that they could look into even around their local area.
Correct.
So the role as the organization
yes.
is very relevant to the UK. I mean, we've actually done. You've done quite a lot of work with a lot of the community organizations. So it's really interesting for us to know what you're about and, you know, the background about what.
So basically what it is that for us is to share best practice, get people together, as well as bring in like chief coroners, anybody within the industry or within this particular field together to come and address our concerns and listen to us. So it's something which can be done throughout any country. If there are funeral directors, if there are people who are dealing with burials, they can come together under one umbrella body, and that's what they can do, and join forces together so that we are actually working together to achieve a common purpose. And that is to try and streamline and try and provide the bereaved person with the utmost of care at a time when it's most needed. So that is the main focus of the National Burial Council. And in this particular, fortunately for me, the two panelists who are here happen to be on my panel, on my board as well of the National Burial Council, both Shaykh Yunus Dudhwala as well as Mufti Zubair Butt, who is the Emir of the Shura panel. So we are working together on that aspect to try and give true guidance in accordance with either government guidelines or from a Sharia perspective and from a practical perspective, so that people can at least see where the guidance is and be comforted by the fact that there are true guidances which are available for the community to refer to.
This is a very multidisciplinary approach, isn't it? You've got ulama, you've got sort of Muslim scholars, you've got people who are specialized in that particular area. You've also got funeral services who clearly play a very active role. And you've also got chaplains and various other people who are involved in the work that you're doing. So what's the current state then in terms of some of the funeral services that are out there doing this work? Have they been given clear guidelines? Do they know what they're doing? Because there is a lot of confusion about whether funeral services know what they're doing.
Yeah, we've issued two guidelines so far in National Burial Council, and a third one will be going out inshallah tomorrow, clearly identifying what you need to do when somebody dies of a COVID-19 death, from the stage, from picking up from hospital all the way to burial. So the entire process has been truly explained, and not only has it been explained, but it also has been backed up by government guidelines, by other bodies like WHO, the European Union, all of that, the Royal College of Pathology, all the other evidence which is needed in order to support what our guidance is has also been attached to it. So it's fairly clear cut from our perspective The problem we've had, Dr. Rafaqat, is the fact that there has been no consistency from the perspective of the government guidelines and the hospitals who are delivering as well from that particular perspective, because they are now trying to follow a different set of rules, which absolutely confuses a funeral director who perhaps possibly goes and picks up a body and is told it's very dangerous, don't do this, don't open the bag. Whereas the government guidelines are very clear, together with other guidelines, that a person who fasted from COVID-19 does possess a risk, but a very small risk. And it is easy for you, if you follow the guidelines, to safely do a ghusl for a person who's passed away. So what the latest guidelines have come up, and what we have now made to do, is that if those guidelines are followed throughout the whole delivery mechanism, be it the hospital, wherever that may be, then we will have some sort of level playing, some sort of consistency, and the confusion, we hope, will be lessened. One point which you picked up, which there is a lot more work to be done on, I totally agree with you, is where there are deaths in the community. That is something which we'll be doing as well, so that we can give advice to people to say, how can they safely pick up somebody who's passed away? This is a very unique situation, and it is a situation whereby people are genuinely afraid, because they really don't understand what the dangers would be or not be for COVID-19. And that is why there are a lot of funeral directors who are perhaps, I won't say scared, I would say apprehensive. And they need a lot of comfort to say that if we were to take this on, what would be our risks? And that is something which we have tried to address in all our guidance. And that is where you are now seeing that there are funeral directors now ready to come forward. There are hubs, as Maulana Yunus mentioned, that people can then be trained and then can take this particular aspect of it and give ghusl to a person who's passed away.
Yeah, so I mean, there are some very important points that you've raised there. One is that the science keeps changing. So in terms of some of the advice that's coming from the science sort of perspective, we're getting different sort of advice in terms of the transmission rate, and also the issue regarding how infectious it is with dead bodies, etc. So there's something about bodily fluids. There's something about in essence, how you actually perform some of these procedures, taking that into consideration. Now, these areas of clarity really are particularly based on the issue of how infectious a dead body is. Now, that's quite difficult, because we're getting different sort of responses from different people in terms of how infectious the body actually is. So let me just turn to Mufti Zubair for somebody who has to give some kind of Islamic direction. When something is, I suppose, a dhanni, so something we're not very sure about, okay? And we've got a lot of anxiety in terms of the transmission. I don't want to be doing ghusl of somebody and then, have been infected. Do I need to self-isolate for 2 weeks? What's the issue here? So these kind of issues are coming to you. How are you dealing with it? What's the approach to the Islamic approach to issues like this?
Bismillahir Rahmanir Rahim. Assalamu alaikum wa rahmatullahi wa barakatuh. Just to give you a bit of background first, it's now been 5 full weeks since I have been involved in looking into the issues regarding coronavirus. And what I try to do is to ensure that any advice that we are able to give is based on sound footing. That is why sometimes you will see that the National Burial Council's advice is coming a day or two after maybe other people have given a fatwa here and there. Okay, and the reason for that is we try to ensure that our advice is based on sound information. Now, for this, I personally, what I have done is I have a lot of reading. I've done a lot of reading. Like I said, for the last 5 weeks, I go to work in the hospital, and from morning to evening, all I am doing is reading around COVID-19, because when it first started, I raised a few issues amongst our network of Muslim chaplains, and I was responses. I asked the question, what about these issues that are going to come up? What about the response? And no one would really come forward with anything. So it came down to myself then, okay, you know what, you are going to have to answer yourself. So alhamdulillah, for the last 5 weeks, I've been involved with this, reading papers, looking at the books of fiqh, etc., and trying to marry the two. Now,
What is about?
yeah.
You're talking about a lot of reading, but what exactly are you reading? Are you reading guidance from certain public health bodies? Are you reading? Are you reading guidance from who? Are you reading guidance from? Because this is another issue, isn't it? Where are we getting our guidance from?
Okay. Well, the guidance is coming from the World Health Organization.
Okay.
Guidance also comes from the European Center for Prevention of Disease,
Right.
Infection and Disease. You have the guidance issued by the Public Health England, NHS England, Royal College of Pathologists, and
all these guidances, are they consistent, or are there differences?
yes, no. From what I am reading, the guidance is consistent. Sometimes it's not specific, and so what you have to do is you have to find the information in there. That is what. When you say guidance has changed, I have not seen the guidance change.
Right.
What I have seen is more clarity on a particular issue or specific issue being addressed. Now, Brother Muhammad Omer, he has been in direct conversation with Public Health England for a little while. And so until we don't get clarity from them, we have tended not to give a position. Okay, so all our positions that we have taken, all the positions I have taken have been based on what Public Health England have said, what NHS England have said, what our local hospital, the guidance that is coming from our local hospitals as well, all of that packed together and trying to decipher all of that and then coming to a conclusion.
And this is a really important point, isn't it? Because, I mean, considering all the different countries, geographical locations, they all have their own public health bodies. So their guidance may be different relative to the country that they're in. There are more sort of vulnerabilities in different societies and different communities, education level, the kind of service and resource in different kind of countries. So it's important that even though we're listening to this and we're sort of looking at the Public Health England in the sense of the guidance that they're giving, every country has its own particular guidance, and we need to refer to that. Mufti Zab, you're talking about the specific guidance in the UK or in England.
I can even say even the Center for Disease Control in America, all the guidance that I have seen is roughly the same. It is not contradictory. That's what I have seen.
What's the gist of it then? What's the gist of this guidance then? What's the important bit?
The gist of this guidance is every procedure has a risk, right? Even if it was not a COVID-19 patient and it was not a pandemic and you had a deceased person, that also has a risk.
Right.
So the question is how much risk? Okay. You have what's confusing people is the situation in the hospital where you have a live patient where they not only is the patient is a heightened risk from the patient, but the environment that you are working in, that's also an infectious environment. So you are finding some of our healthcare workers, they are going down with illnesses because of the environment they are working in. That is being transplanted onto the dead person, the persons who have died from COVID-19, when in fact it's not the same. Okay, so and even when I've been reading through the sort of different levels of guidance in relation to what kind of personal protective equipment needs to be worn, there is different levels even in the hospital. Yes. There's the full body suit and the FFP3 mask.
Depends on the exposure, doesn't it? So if you've got aerosol procedures,
so it's not a case of everybody needs the same PPE. Now, when it comes to the dead body, the health and safety executive, they have good paper on this, and it describes the different ways or the different transmission risks that you have. You have transmission risk from contact. You have transmission risk from aerosols, and then you have the transmission risk from airborne. That is airborne. Now, in the case of COVID-19, it's not an airborne virus, and also, especially from a dead person, you're not going to get anything airborne. So you have two things left. You have either aerosols, and I would include in that, other fluids of the dead body, and you have contact, physical contact. So for physical contact, you are wearing personal protective equipment, and for aerosols, there will be very little generated at all. And only that would only be generated if you are mishandling, not just handling, mishandling the body where you are getting the body to exhale air. So only then you potentially you would have something airborne. So the risk is actually quite minimal. And in all the guidance that I had, they do say it is, like I said, nothing is without risk, but this is minimal risk that can easily be mitigated. This should not be confused with a patient who is a live patient and who is in the hospital. This should not, the two should be kept separate.
Okay, so there's something about the risk being minimal. Okay, now the risk being minimal is one thing, but there's something about that if you do get infected, then the consequence is quite serious. So it's a risk that some people just don't want to take. So on that perspective, is there a sort of a window approach to this in terms of where the Sharia allows for even this level of risk, where you have some people who have certain anxieties? You know, what's the most that we can do? What's the least that we can do? What's the most that we can do in this situation? So what I'm going to do is, because I know there's a lot of people out there who want to ask a lot of questions, and I'm going to open it up to them in a short while. So I'm just reiterating a couple of points that have been addressed prior to this, and that is even the procedure itself. So looking at the procedure from the Sharia perspective, we've talked about a couple of things. We talk about ghusl, which is the asl, which is the thing that we should all be doing. And then there's a ghusl through the sunnah methodology, and then just doing ghusl, which is not the sunnah approach. And then there's also the issues related to tayammum. So that's dry ablution. And then there's also the issue regarding a person who has the kafan, and then you're doing tayammum on this, and also issues related to them being in a bag, and you're doing tayammum on this. So you're getting all these contrasting sort of statements that are coming from some of these guidelines. So what's your take on this?
Okay, this is a novel virus, and it's a novel situation for all of us, right? So what you are finding is, as scholars are learning more and more about the virus, as they become more aware of what the virus entails, the guidance I say is being developing. Okay, initially, I mean, and for me personally, I think whatever guidance you give, you have to look at the impact on what you are going to say, and whatever you say has to be on very credible grounds. Okay. So if you have someone who's just fearful of, because of all the hype around COVID-19, just fearful of it, but their fear is not based on sound footing, then I don't think you can give a legal position based on that fear that has is
a subjective situation.
It's got no sound basis, and so therefore that is discount. If you have a fear that is based on sound information, then obviously that is taken into account, and then that will give them some dispensations. Currently, I would say it should be very easy to, if you have the appropriate personal protective equipment, to give a ghusl in a safe manner. If you have anxiety with regards to doing the full sunnah ghusl, fine, don't do the full sunnah ghusl. At this point in time, we want the person to have a ghusl, even if it's just putting water over the body just once, getting rid of the impurities. That is sufficient for ghusl to take place. Yes, we can do more of that, but not everybody has that expertise, has the facilities, has the personal protective equipment, or that assurance. At least the minimum can be done.
Okay.
If that is not possible, for me it's a case of if you can't do ghusl, then there is very little. And you are, for example, people are scared or they're being advised that don't open the bag. There's infection risk. Then tayammum goes out the window as well, because tayammum you do on the physical body of the individual, and if you can't open the bag, if there's infection risk, or open the bag as some have been advised, then you can't do ghusl and you can't do tayammum. Okay. Initially, advice I was of the opinion that you could also wipe over the bag with a wet hand as muster, and doing drawing an analogy with wiping over a bandage. Okay. However, that position has been called into question, and I personally also have changed my position on that. Say that is not something that's applicable. There's not there's a difference between having a bandage and difference between being in a body bag. And if you look at the text of the fuqaha, you will find that the tayammum, the substitute of ghusl, but it doesn't go beyond that. It goes either you do tayammum or ghusl or you do nothing. And there's no wiping over the back. And that is the position that I'm most comfortable with. I have discussed with others as well. Some may still have a different position, but generally when I shared the advice and the reports I have with others, they have generally said, yeah, okay, this seems right.
So I'm assuming that the difference of opinion is based on two factors. One is on the science, okay, which basically tells us that there's a certain vulnerability in the sense that this is the transmission sort of risk, okay? And the other is in terms of the facilities that we're doing this in. So if I go back to Shaykh Yunus, from your experience, how are families dealing with this issue? That they are being told that now, you know, your sort of deceased sort of close relative is now in a situation, they are now, you know, with the funeral service, it's time to do the ghusl or it's alternative. What's the current situation? What is it? What are most people doing at this moment in time?
So as we've discussed, there's been a lot of fatwa out there.
Yeah.
Some have said no ghusl at all. Some have said tayammum. Some have said minimal washing. Some have said we can do everything. And I think many families,
right,
they are receiving different kinds of information.
Okay.
And in different parts of the country, especially in the UK, there are different practices. So it depends where people are, and it depends who they speak to. So
it could be argued that there's some element of ihtiyat here. So something more cautionary.
Yeah.
Let me just reiterate this because I think this is a really important point. Even amongst doctors, okay, even amongst doctors, you are getting doctors who are taking it differently. Okay, even though the guidelines are straight, guidelines are very clear. But even doctors who are being exposed to these individuals, they are dealing with the guidelines quite differently. Some of them, the kind of PPE that they're using is much more stringent than others, solely on the basis of what they feel comfortable with. So there's a question of what you feel comfortable with to some degree. And sometimes your comfort factor is based not solely on the basis of your anxiety, but how much you have in terms of the trust of the hygiene of the place that you're working in. So it could be a number of different factors, you know, in terms of the resources you have, and, you know, various other factors like that. So what
can I just, I just want to come back on that. So for example, you're right. Some people will be taking more precaution than what the guidance suggests. What Mufti Zubair has mentioned in terms of the Public Health England, the
Yes.
World Health Organization, the European scientific organizations that are saying there's less risk or there's minimum risk. Some people want to take extra precaution. And I'll give you an example. There was a video that went viral recently saying there's no body bags in the hospitals. And the reality is body bags are not necessary for a deceased COVID-19. So for example, the body that the funeral director wants to collect, if it doesn't have a body bag, that means that body has already been moved from upstairs from the ward to the mortuary without a body bag.
Right.
And therefore, a funeral director can collect that body without a body bag.
Okay.
However, some funeral directors are uncomfortable to collect, and that's their own precaution.
Yes.
It's not the government guidance.
Right.
The PHE, Public Health England, and the World Health Organization both mention that body bags are not necessary for a deceased.
Right.
Okay?
Okay.
And similarly, this is the same case for ghusl as well, with the washing. Now, we at the National Burial Council, Mufti Zubair and Sheikh Abu Isa and others have been discussing whether there is a safe way to perform the ghusl. We don't want to put anyone's health at risk.
Mm-hmm.
And the question is there a safe way or is there not a safe way? If there is a safe way, then we would prefer that the ghusl is done. If there isn't a safe way, then we say do the ghusl and do tayammum or do something else, whatever the ulama have mentioned. And we have found that the experts are saying and I've spoken to senior pathologists, I've spoken to senior infection control people, and all of them have said that if you have the right personal protective equipment,
Right.
and we do the right things during the ghusl, we don't do what we might have been doing previously, then it can be done.
Okay. Right. Muhammad Umar.
Yeah, just to mention the few main points, and Muhammad Umar will clarify them.
Right.
The 3 or 4 main points that I can remember, which I will just remind people. Number 1 is having the right PPE. Number 1.
Yes. Mm-hmm.
Yeah. Number 2, a ventilated facility.
Mm-hmm.
Yeah. Number 3, when we do the ghusl, we shouldn't use any spraying object. So you shouldn't have a shower head.
Right.
Because then you're creating more splashes.
Okay. Just a container with water, and then you just pour it gently.
Sugar and water, that should be enough.
Without
and also minimal movement. One of the doctors who I spoke to, and if you look at the WHO guidance and the Public Health England guidance, they talk about minimal movement.
Right.
So therefore, you need to do the ghusl, but do it with as much minimal movement as possible.
So a movement would basically cause splashes, in essence. Yeah.
Or it could cause air coming out of the mouth or anywhere else. And that's why Muhammad Umar will mention that we normally cover the mouth straight away.
Okay.
And we cover the nose. So wherever any COVID might come out from, by the movement of the body, we will cover them.
So what's the minimum PPE that we're talking about here?
The minimum PPE, I'll let Muhammad Umar, because he's done approximately over 30 or 40 ghusls already.
Muhammad, I've got a few questions for you now. So the question now is, there's something about what's the minimum PPE that we should be using. The next question is, what are most funeral services doing at the moment, this moment in time?
Unmute. Oh, sorry. Okay. Assalamu alaikum. Right. The minimum PPE you should require is you need an apron. If you have a full apron, it's better. If you don't, then at least an apron. You need gloves. If you can get 2 pairs of gloves, is even better. A facial mask and an eye protector, either a visor or a goggles. Shoe protector. If
when you say the facial mask, are you talking about the surgical masks?
Surgical masks. Yeah, surgical masks. Goggles if you have. If you want to cover your hair or your beard, if you got that, that's fine. This is the minimum you would require.
Right. Okay.
Yeah. So that's the minimum.
What are we getting out there? What are most people doing at the moment? Are they using minimum?
I mean, Gardens of Peace, alhamdulillah, we are at the moment doing ghusl. So
right.
To date, we probably would have done over 60 or more. So we are doing ghusl.
When you say you're doing ghusl, I'm assuming that you're doing the minimum that you need to do for it to be considered ghusl. Is that right? You actually do the minimum.
I can just explain, as Mufti Yunus has said, we cover the mouth and we cover the nose. And also where you have to have absolute minimum movement, but we can wash it very gently. We do that. We will not scrub the body as you would normally do when you do a normal ghusl. You would make sure that the area below the aura is just done with the water, and that's it. Nothing more than that done. So that would we have done, and then we would absolutely make sure that it's given proper kafan in the normal manner. So you would even pour your kafur water as well as the last coating. So you would try and do the three phases of water: clean, wash, clean, and then you put your kafur water. So you go through that entire process. So we are doing it because we are confident. We have been doing for a long time, and alhamdulillah, we have the facility to do it. Our room is well ventilated. It can be done, and can be done safely. Maulana Yunus has witnessed one as well, and also a couple of imams have witnessed one. So it can be done. A number of the other funeral directors are not doing it. Some are doing it. I must hasten to add. Some are now taking the initiative to do it. A few hubs have been created recently in East London. Alhamdulillah, they've been trained and they have actually undertaken about 10 or 15 ghusls already of COVID-19. So people are getting the confidence because now they know it can be done. They've seen it happen. It's not very cumbersome. All you need to do is a bit careful. That's all you need to do. But my analogy would be is that you would treat this. Remember, before this pandemic came through, you still had bodies which were hazardous, which were infectious. You were still washing it.
Yes.
So why didn't anybody
question at that stage, and why could you not wash the infected body? Why are they questioning now? If you don't want to do it, or you feel there is an element of risk, or you're not able to mitigate that risk, then you don't do it. But if you think you can do it safely, then my personal belief would be that if you can do it safely, then you should try and do it. That would be my belief.
So basically, the idea is you try as much as you possibly can within the limits and the confines of the safety protection issues that you have in that environment. Okay, right. So
sorry, can I just add a very important point? Apart from washing, the more important point would be is that of disinfectant. Yes. And how you take out your PPE and in a correct manner. Those two things are also very important in addition to the actual ghusl.
Now, is there any guidance about self-isolation? So do these individuals who are actually doing the ghusl, do they self-isolate afterwards?
No,
there has been some information going around or circulating that some of these people who actually go and do the ghusl, that they should self-isolate. So we need to clarify that point. I mean, this is a question open to all three of you. Is there any information that you're receiving from any of the government? And we need to clarify this because I've already had 2 calls by individuals who are saying that, do we need to self-isolate? We're going to ghusl on somebody with COVID. Do we need to self-isolate? And the response to that is a clear no.
No. And I think just to clarify, I think Gardens of Peace sent out a circular during the week where they said some of their staff had to self-isolate. And the reason was not because of the ghusl. It was because of the number of attendees at the funeral.
Right.
One of the most senior pathologists in this country, when I spoke to him about the ghusl, he said to me very clearly, he said, there is more risk of catching COVID-19 from the individuals who attend the funeral than there is during the ghusl.
Very true. And okay. And I suppose you're off your guard, aren't you, with people who are there, rather than you're on your guard with the dead body. So from that perspective, what's the maximum number of people? What's the guidance telling us? What's the maximum number of people who can actually perform the ghusl at that time?
I think
my guidance.
Go on, Mohammed Omar.
Sorry, Balagh. Okay. My guidance would be is that we do it. 3 people from my staff do it. We don't allow for COVID-19 any family members to be there. So from our perspective, 3 of them. If it's a big person, then we may allow more. In my view, I don't think you should have more than 4, maximum 6. Even 6 is too much. I would err in the side of caution. If 4 of you can do it adequately, then I would be recommending to save only 4 people. That would be my recommendation. I don't know whether Shaykh Yunus and Mufti Zubair agree with
No, I think that's correct. I think 4 people is more than enough. Okay. And sometimes, and we know that people will be emotional, families will be emotional, and they want to take part. Majority of the ghusl facilities that have opened for COVID-19, they are not allowing families to take part because that increases the risk for those who are doing the ghusl. Remember, we don't have that huge number of people who are doing the ghusl. If one person comes in from the family who should be isolating, comes into the room, joins the ghusl, makes these 3 other people who are doing the ghusl for the community ill, then we've lost the ghusl facility.
Okay.
It's very important that, yes, we have our emotions, but we need to control our emotions and understand the bigger picture for the Muslim community if we want to continue the ghusls.
Okay, so we're in a situation where we've got different funeral services. They're behaving in slightly different ways. Some are more cautious than others. There's also something about trained people who are doing the ghusl. So I can see that there's a greater number of people being trained in this particular area, which is a sense of confidence for everybody. We're trying to avoid family members being there because of the clear, obvious emotion that they have. And sometimes because you're under emotional state, sometimes we can't reason too well, and we may behave in a certain way which will put others at risk. So there's some very important points to be raised there. Going back to this issue now, for those of you who are using chat, ideally if you can use Q&A, then I can refer from one particular source. If you're using both mediums, it makes it very difficult. So if you use Q&A, and inshallah I'll try to address some of the questions that we have from there. I'm just going to mention 1 or 2 issues here, and then inshallah I'm going to open it to the audience. The first issue is regarding burial. So I think there's a minimum number of people for burial, isn't there? Sorry, the maximum number of people who can go to a burial. There's something about people who are trained or they have a good understanding of how to actually lower the body into the grave and actually perform the procedure. And there's also something about other people who are there, how much of a distance they should keep, and various other things around that. So just focusing more on specifically around the burial. What are the current issues related to burial? Can we carry on doing the burial as we do normally? Are there any implications in terms of how we do burials differently?
Shall I take that?
Muhammad Omer.
Yeah, we can, according to the guidelines, we can bury in the normal manner. You can bury in a body bag or you can bury in a coffin, depending on the cemetery regulations. So it's really down to the cemetery what you want to do. For us, we are allowed to bury without coffin, so we are continuing to bury without coffin. At the time of lowering the body, we don't allow any family members to be nearby. Our staff are fully geared, fully protected, and we lower the body in the normal manner, turn the body around towards Qibla as you would normally do in the Sunnah manner. We put in the planks, and then our staff will move back, allow the family members to come in, put 3 handfuls of earth, and then they will move back and we'll get our diggers to put the soil back. We allow only 5 people to come in for any funeral at a time, and they should maintain 2 meters social distancing from themselves, right? The government guideline also is saying that, immediate family. However, we at Gardens of Peace have taken the view, and so has other cemeteries, that we only allow 5 people of the immediate family to come through. If they've not read Salatul Janazah, then they can read Salatul Janazah at the cemetery itself. So that is what we are doing at the moment. And at the moment, it does not seem to pose a problem, but there might be a problem going forward if the level of deaths increases so much that we may even have to consider that, listen, we may have to reduce the numbers so that the throughput goes through quicker. So we are not depriving any family member, one family member or someone from the family from attending the funeral. They can make dua as well if they wish to do so. But the whole aspect of it is they can witness their loved ones, a member of their family can witness their particular loved one being buried with their own eyes for them to get the comfort they require. Because that is one of the emotional things which will be playing with people's mind, that today I can't even go and bury my father, or I can't even go and bury my mother. That emotion is so difficult that if we deprive that from that individual, it will be very difficult for that person to come to terms with, to say, I was not even able to give the final rights to my father or my mother. So this is why we have taken the conscious decision. But at the same time, we will emphasize that there should be a distance so that my staff does not get infected or any staff does not get infected anywhere, so that we can continue to provide a service to the community and burials can take place. This does not only apply in this country. I would recommend this applies to every country.
So there's clearly some clarity on the fact that when we do go to funerals or we're going for burial, or even for ghusl, the main issue is that we are socially distancing ourselves as individuals, rather than actually from the dead body, which clearly has its own implications. Okay, right. So that's clear. I'm just going to state 1 or 2 comments from. We got somebody from Stockholm, Sweden, and he's saying that at the moment what they're doing is they're doing tayammum. So tayammum, for those people who are not sure what tayammum is basically where you actually get some kind of soil or clay and you wipe it over the body or over the coffin or something along those lines. So he's basically saying they're making tayammum on body bag, so not opening, as they're saying, we are not allowed to at the hospital to wash from now on. And this has been about 5 days back, so I don't know whether that's changed now. So now we have tayammum and janazah in small groups and burial. So the question he's putting forward is this approach that you've taken in the UK for ghusl and burial, is people fearing now ghusl changed. So basically there's, what would you advise them in that kind of situation? What would you advise somebody who's in that kind of country where clearly they're being advised? I don't know whether that's a governmental advice or it is specifically to the hospital, and whether that's changing, recognizing that the science is changing over time and the guidelines are getting updated in terms of what's going on. So in that kind of situation where the hospital is insisting, or you're in a country where the government is insisting that you do it on one particular way, Mufti Zubair, are we mukallaf? Is that a problem for us as Muslims? Do we have to keep pushing? What does the Sharia allow us to do in that situation?
Okay. Bismillah ar-Rahman ar-Rahim. First of all, let me just go back to what tayammum is. Tayammum is where you strike hands, somebody strike hands on some kind of dusty surface, stone, etc., and then wipes the physical arms and face of the person that has died, deceased. It's not about doing anything on the body bag. That's not tayammum. Tayammum means, the word tayammum means to intend. So you intend the face and the arms of the deceased, for the physical face and the arms of the deceased. That's tayammum, nothing else is tayammum, right?
So there's a confusion between masa and tayammum.
Yeah,
Seem to be
okay. Like I said, initially, we were advising masa of the bag if you weren't able to do ghusl and tayammum. But now, personally, I have changed my position on that, Mufti Yunus, as well, that after being, some scholars have written on this, that actually is not a valid position, and I understand, I agree with their reasoning. So we are now saying wiping over the body bag is not, we never said it was a requirement before as well. We said, okay, do what at least the minimum that you can do, but it would appear that even that is not something that's applicable. So for example, in Sweden, where we have been told that there's some kind of restriction, if it's simply advice, fine, you don't have to go by that advice. If it's a decree by the government, you are not by law allowed to give ghusl or do tayammum, then you are, you have no option but to bury the deceased without any ghusl or tayammum. My position is masa over the bag is not a valid position, and so therefore they can be buried without ghusl and tayammum because of the legal requirement, and without that ghusl and tayammum, the janazah will be done.
So this is a very, very important point for those of you who have sort of framed the question in this kind of way. There seems to be a bit of a confusion between masa, which is to do with wiping, and tayammum, where clearly there's a particular procedure and there's a process and a way that you do things. So there's something about wiping the appropriate parts of the body, the arm, the face, in that respect. So you need to differentiate between the two, because people don't seem to understand that they are quite two different things. So and the other point to raise there is clearly if the governmental guidelines in whichever country you are sort of clearly saying that this is the way you need to do it, then you're not held responsible for that. That's just the fact that you have to abide by what the government is pushing in this particular case. Now, what I'm going to do is I'm just going to mention one or two other questions here, and then what I'll do is I'll open up to the audience. If anybody wants to speak, they can raise their hand. Now, there's 2-3 things that have been very important in this discussion, okay? And I'll bring those 2-3 things. The first thing is related to mahram, okay? So mahram is somebody who clearly, I mean, I suppose one way of defining mahram is somebody you can't marry, you can't have nikah with, okay? So they are usually very close blood relatives, either your brother, your sister, your father, your grandparents, and various other things. Okay, so your cousins are not your mahram, by the way. So just for to reiterate certain points here. So on that basis, now we're in a situation, the number of bodies and the number of deaths have increased quite considerably. In that situation, Mufti Zubair, what's the issue about mahram? Because clearly we need a Muslim man doing the ghusl for a Muslim male, and a Muslim female doing the ghusl, because this is the default position, a Muslim female doing the ghusl for a Muslim mayyat, so a Muslim woman who's passed away. So if things are not possible like that, what is the order in which we should do this?
Bismillah ar-Rahman ar-Rahim. Okay, as you have just said, first of all, a Muslim man should be doing the ghusl of a Muslim male, and a female should be doing the ghusl of a Muslim female. If a Muslim male is not available, then the next would be a non-Muslim male. Okay, and that would also suffice as well. In the Hanafi school particularly, the person doing the ghusl does not have to be Muslim. However, in certain other schools, because they're considered to be an act of worship, and an act of worship can only be done by a Muslim, and so there they require that the person bathing the seas will be it has to be a Muslim. Okay. If a male is not available, then the mahrams, they can do tayammum of the, for example, of the male. They can do tayammum of the male, and if such is not available, then what you can do is you will have to bury without ghusl or tayammum.
Okay, so there are limitations here, aren't there, in terms of the fact that one thing that we want to avoid at all costs is non-mahram women doing the ghusl of men and non-mahram men doing the ghusl of Muslim women. Okay, so this
that's simply not allowed.
Yeah, so that's the main point to take here. The other point is about jewelry. So I'm going to mention this to, I'll put this to Muhammad Omer, I think, more so. The issues of jewelry, there's some problems there, aren't there? Women who are elderly, for example, they're very unwell, they're on the process of heading towards the hospital. South Asian women tend to wear a lot of jewelry, a lot of gold. You know, is there problems with this? Is that problematic?
It is problematic, and specifically when there's COVID-19 cases, because in the past, hospitals used to remove everything from them before they used to transfer the body to the mortuary and put the belongings in a nice bag. Now what's happening is that sometimes there is jewelry on the particular individual, and you really do not wish to move the body, so it is easy to remove it.
But Omar, can you come closer to the mic? Come closer to the mic.
Yeah, I think the sound is a bit low. Yeah.
Okay, fine. So basically, so what I'll just start again.
If you could start again from the beginning.
Yeah, okay, fine. So the issue now is that hospitals are no longer removing the personal belongings of a patient. They used to remove that before, they no longer are. So they just, if a person has died from COVID-19, it goes in a body bag straight, and it comes for the person who is coming for ghusl or whatever it is. So therefore, if you are not opening the body bag, there is no chance that you will be able to remove the jewelry in any case. And if there is jewelry and you are washing, at times it's difficult to remove it because you don't want to move the body unnecessarily. So you will have to just leave it, right? So we have had cases whereby there has been jewelry, but in one or two cases it's just earrings, so which you could easily remove, so it's not an issue, right? But it is a case people have been asking us, was this there, was this there? We don't know half the time because we are not going to be searching around everywhere what's happening. So it is an advisable issue that if you are going to hospital now, you should not be wearing anything at all. And that's my strong advice to everybody concerned. Fortunately, in all the male ones we've done, we've not had any jewelry issue. So maybe the males are better in terms of when they're going to hospital, but there have been one or two women who have had jewelry on, but I can say that we have managed to remove them safely for those two. But if the body bag is such that it's got a lot of fluid in it, and say that 2 body bags, then definitely it will be difficult to do ghusl to that and difficult to open the bag.
Okay.
Sorry, Dr. Rafaqat, just to add on to that, in one of the new Nightingale Hospital in London, if there's any jewelry that's been taken off the patient, the infection control has said that we should store it for a week before we give it to the family, just to be safe. So maybe those funeral directors who are taking off the jewelry, just leave it aside, label it, and leave it for a week in disinfectant or whatever. But that's the guidance from the infection control lead at Nightingale Hospital.
Okay. I mean,
that's what we are doing. That's what we are doing. That's what we are doing at the cemetery. We are disinfecting it, leaving it aside, and then they can come and collect it.
Right. Okay. There's also something about, this is quite troubling actually for many people. I'm just reiterating some of the questions that are out there. And that is the issue related to the fact that hospitals are contacting patients, relatives directly, and saying that so-and-so has died, your close relative has died. So the process is running on that basis. Now, we're getting sort of feedback from certain people that it's done in a quite abrupt way. I'm not sure whether it's intentionally supposed to be like that. I think people sort of expect, you know, some kind of approach to this in terms of breaking bad news and so forth. Now, from your experience, Shaykh Yunus, what do you advise families in that situation?
I mean,
In terms of dealing, so if they're suspecting an elderly family member who's got COVID positive, he's ended up in hospital. And in fact, we've got cases where people who are not COVID positive confirmed, but they just ended up in hospital, and then suddenly they've been told when they've died that they were COVID positive. So
yeah.
what advice would you give families who are in that situation?
I think the first thing for the families is, what's important is, just because somebody has died for of COVID-19, do not think it's something bad. I think some people are very anxious. They've got a lot of anxiety and fear, and saying, oh, our loved one died because of an infectious, and the body is infectious, etc., etc. I think we should avoid these kind of thoughts. Allah subhanahu wa ta'ala is going to give us death in different ways, whether it's a car accident, or whether it's a heart attack, or whether it's a brain tumor, or whether it's cancer, or whether it's COVID-19. That's an excuse for Malakul Maut to come and take our ruh. So that's the first thing. So do not become anxious just because someone has died of COVID-19. However, because of the precautionary measures we have to take, the way that we deal with the funeral issues is going to be different. And if your loved one is in hospital and there is a Muslim chaplain there, then try and get in touch with the Muslim chaplain. They might be able to help you a bit more because that's their responsibility. Sometimes they might not be even allowed to go onto the wards where your loved one is because of the restrictions that are currently in place, but at least they will be able to give you some kind of comfort. And then the communication issues, that's always going to be hit and miss. Some people are very compassionate in the way that they speak, and unfortunately some might be a little bit abrupt, and this is just the nature of the world at the moment.
I think it's also very important to recognize, with all this sort of media exposure to COVID-19 and the anxiety that it's raising amongst everybody, that there are certain people who are just vulnerable. They just happen to have been confirmed of being COVID-19, but their death has not been because of COVID-19. They may have died from a heart attack, they could have died from a stroke, there's other reasons that they may have died, but it's just later confirmed that they were actually COVID positive as well. So, we need to be very careful about what the current situation is. Also recognizing, and this is something that some of my medic colleagues are telling me, especially those who are involved in sort of cardiology, in terms of dealing with people who are having heart attacks, that there is a reluctance amongst our public of actually going into hospital. So some of these individuals may actually be at home having a heart attack and various other things like that, and they're not seeking help because of this reason. So, there's some real anxieties amongst them, the doctors as well, in terms of, how people are, their health-seeking behavior, in the current climate. So it's very, very important that if you're concerned about anything, you must communicate with your GP, or ring your practice, ring your local health line, or something along those lines, depending which country you are, to get the appropriate health advice, rather than avoiding, going into hospital and putting yourself at risk. I'm happy to allow somebody to ask any questions if they want to come online. So if anybody wants to come online and ask any questions, we don't have very long now. So if there's anybody who wants to ask any pertinent questions, please make it relevant. There's been one or two questions that have not really been very relevant, so I've not really addressed them. But if there's anything that anybody wants to ask, anything in particular, while people are sort of volunteering to do that, let me just put one or two other questions before you. In terms of guidelines, I think this is really important. So we've got the guidelines currently from Mohammed Omer, from your current organization, and the National Burial Council. Are you thinking about updating those guidelines? Are they still the same? Are we going to be changing them? Are we going to give more detailed guidelines? Because some of the funeral services are still a bit unclear. So in that respect, are we doing some work? Are we expecting something from you guys?
I think I'll let my Amir say, Mufti Zubair.
Bismillah ar-Rahman ar-Rahim. Inshallah, our third set of guidelines, inshallah, should be coming out tomorrow. It's just being proofread and just ensure all, all the T's are crossed and the I's are, I's are dotted. Alhamdulillah, because we have taken it, I think, personally my opinion is that because we have ensured that our guidance is based on official guidance, Public Health England and other bodies, and as far as burials, etc., is concerned, it hasn't. Their guidance hasn't changed. It may have been clarified, but it hasn't changed. So I think our guidance more or less will remain the same as before, and maybe just a few additional points of advice really. But the central guidance, I think, will remain the same.
Okay. There's just another question that's come up here in the sense that, and I think this is another point that's quite important to clarify. And then I'm going to just go on to a different topic, slightly different, and which is really important, and it's going to happen, and it's coming at us like a tsunami at the moment. The first issue is in relation to this idea about sort of shaheed. Okay, so when somebody is classed as shaheed, what we have been told is when somebody's a shaheed, you don't even need to do ghusl on them. You don't need to even read janazah on them. They are alive in their graves, and there are many ahadith which make reference to that. So on that perspective, is this something that we clearly recognize when somebody has died directly from COVID-19? Are they shaheed? Is this the same kind of shaheed? Is this different? Mufti Zubair, can you elaborate on that point? Because that's something that's confusing people.
Yes. Bismillah ar-Rahman ar-Rahim. The normal type of shaheed that dies on the battlefield, that is a different type of shaheed, and that has specific rulings in that the person who dies on the battlefield, and there's also certain rules with regard, they have to die on the battlefield and not have to be brought home, etc., etc. So somebody dies on the battlefield, they're not given ghusl, and they're not given the kafan. Okay, and both in this world and in the hereafter, they are treated as a shaheed. When there's several hadith, several sayings of the Prophet ﷺ, where people that have died in different situations are considered to be a shaheed. Somebody who dies of some ailment of the stomach, or somebody dies, some trauma, etc., etc. And one of them is also somebody who dies in a plague, etc. And in this manner dies an untimely death like this in a pandemic. That person also is a shaheed in terms of the hereafter. Means their sins will be forgiven, etc., etc. However, in terms of the dunya, in terms of this world, would treat them as a normal deceased. And so the ghusl and kafan, etc., applies over here. The janazah will be all of that will be just as any other normal shaheed. And that is different to those that die in the battlefield, where we don't give them a ghusl, we don't give them a kafan. So some people have confused this, and I've even seen some statements from scholars that said these people have died as shaheed, and so there's no ghusl. And that is totally against all the contrary to all false schools. The Hanafi school, the Maliki school, the Shafi school, Hanbali school is a contrary to all of these schools, and simply is incorrect.
Okay, we're getting one or two little queries. One query very quickly is about somebody recording the ghusl. Okay, so can we record the ghusl? Can we, for the close mahram, so that they feel as if they're there? So these are some of the questions that are coming through now. I'm just reiterating the question.
Let me just comment on that.
Yeah.
There is a right of the deceased to privacy and to confidentiality. Yeah. And then I can understand the desire of the family to be there and wanting to witness it as well. Personally, I'm uncomfortable with the ghusl being, streamed live, etc., because primarily the right of the deceased will come first before any relative's desire to be part of the deceased or see, observe, etc. So for me, you run the risk when giving ghusl, for example, of exposing the deceased or other things happening which which are supposed to be kept hidden. So therefore, I would be uncomfortable with that, and I would incline towards that the right of the deceased here to privacy would outweigh the right of the family, or the desire, not even a right, a desire of the family to want to witness the ghusl of the, if it can be done in a manner that doesn't compromise the dignity, etc., of the deceased, possibly, but I am very uncomfortable with this.
Okay, reiterating a point, I think one or two people joined later on, but just going back to this point regarding the procedure of the ghusl, I think this is usually causing most of the issues, really, isn't it? So the procedure of the ghusl, the panel has clearly recognized that the transmission from the dead body to those individuals who are actually performing the ghusl is actually quite minimum. It's not as people may seem it is. However, you need to act on caution. You need to ensure that you've got the full PPE, the full sort of, equipment, ensuring that there's full hygiene around the area that you're working in. And also, then what you can do is you can perform the ghusl within the limits that you have, ensuring that you're not causing any splashes and various other things. And these are very, very important points that have already been identified here. Now, we recognize that different funeral services have different sort of areas of caution, and that may be related to a number of different factors. It could be due to the lack of experience of those individuals who are performing the ghusl. It could be related to the anxieties of the funeral services and the sort of the equipment that they have there. On that basis, what you need to do is you probably need to discuss either with some of the local imams in your area related to that particular funeral service, whether they're doing things appropriately. So this is generic advice that we're giving you, but it may be very specific to you depending on where you are in geography, in terms of where you are around the world. Now, there's another very, very important issue that's going to arise, and it's going to probably come very soon, and that is the issue about ventilators. I know it's not directly related to this, but it does have a link somehow. So we've got individuals, we're in a situation now where we are being told, and there's we've got sort of precedents in places like Italy and Spain, where what's actually happening is doctors are now making decisions on the basis of the outcome of the patients, on actually deciding not to basically either, first of all, to withhold ventilators for certain individuals. So, for example, you have an 80-year-old or 70-year-old, let's say, who's got sort of lung disease, and they've come in and they're clearly, they've got COVID-19 or whatever, and they're in this situation. They're having breathing problems. They need to go on a ventilator to actually keep them going for some time. But we've got somebody else who's come in who's 30, perfectly healthy, fit. We have issues with the resource allocation. There's only a limited number of ventilators. We need to now think about this other individual. Now, Mufti Zubair, first question to you. Is it an obligation upon us for us to go on ventilators? We're in that kind of situation where normally, doctors would recommend that we would go onto ventilators. But in this climate, is there an obligation? To what degree do we an obligation for us to seek treatment?
Bismillah ar-Rahman ar-Rahim. Okay, Jazakallah, thank you for this question.
Sorry about putting you in the spot. I think there's going to be a lot of information coming out on this.
Yes,
we might even have to do this session at some stage.
This is a question that I have discussed with some of my teachers, and one of the responses I got was that well, let the doctors decide what they want to do. Right? For me, that is insufficient. I think we have to have a position of Islamic what is correct. First of all, the question of whether it is actually an obligation or mandatory to actually go on to use the ventilator. Okay, and it can only be mandatory if definitively you are going to get what you are desiring. And if that is not definitive, for example, you have someone who the potential of that person being cured is actually very minimal. It's actually just it's not a dominant presumption. Then to put that person on a ventilator is not necessary. Okay, because the means that you are going to adopt is not definitive that you are going to get treatment. There is a very tricky sort of a balancing act that possibly, hopefully, we pray that doesn't happen. It has happened in Italy, where the doctors are having to decide between two individuals who both would benefit from going onto the ventilator, but one has better health outcomes. And I understand this week the General Medical Council, they have also given guidance on this and written to doctors and said that, okay, you know, there is a certain sort of criteria that they will use. And I don't envy anybody that has to make that decision. But if a decision had to be made, Islamic is a mechanism for that, in where you look at the maslahah, you look at the benefit, you look at the interest, and you look at the mafsada, you look at the harm. And so you have to weigh the benefit and harm. Whenever you have scarce resource, you have to weigh the benefit and harm, and then decide on the balance of where the benefit lies, where the harm is, and decide on the balance of.
So what we're looking at is the lesser of the harms, in essence, aren't we?
In the lesser of the harms. It's not something. I don't. Anybody has to make that decision, but that ultimately, if it comes to it, yes, that's what it should be.
Yeah. So the lesser of the harms. So okay, I'm not going to go too much into that sort of detailed question because chances are that probably will be discussed quite thoroughly in some of the other sessions that we're going to be having in the future. Okay, inshallah. So what I'm going to do is, because we're running out of time now, so just reiterate a point that I think Sheikh Abu Isa.
Can I just say something on that, please, Dr. Rafaqat?
Okay, yeah, go ahead.
Can I just say on that last?
Yes, you can speak.
Yeah. Sorry. What I just wanted to say, what I wanted to say, the question you asked about respirators and who will get priority. If I can just say that the government do have a moral ethics advisory council, which is actually considering as to what would be the criteria in terms of determining who should get this and who shouldn't get that. So there is a balance being done, and obviously all the medical bodies are being consulted. So they are actually very, very conscious that they will have to make a decision of this nature. I don't know when, but they have made plans of it already. So I just wanted to let you know that there are balances, because people will question on what merit and how did you determine whether this individual should have got it and the other didn't. So that's why the government has
even for doctors. I mean, I'm talking from a doctor's perspective. There are guidelines that already are appearing now, especially from British Medical Association and various other sort of organizations. But going back to what Mufti Zubair was saying, that we need an Islamic understanding of what Islam says about
Absolutely. I agree.
Even though we're in a situation where clearly we would have to go by what the approach is according to the sort of the public bodies and the ethics committees where we are. Just to reiterate, Shaykh Yunus, you want to tell us a bit about, this is quite an important point because people want to know about this. Tell us a bit about Shaykh Abu Isa. I know he is somebody that we were planning to maybe get onto the panel today, but I think we were sort of wanted to limit the panelists. Just tell us about this video that he's done. Just give us a bit of an idea, give us a bit of advice about how we should.
Yeah, so Shaykh Abu Isa has recently joined the board, the Sharia board of the National Burial Council, and he's been discussing with myself and Mufti Zubair about the different aspects of COVID-19 ghusl, how to do it safely, what to avoid, etc., etc. And we felt that we needed a demonstration video which would make it easier for people to understand what PPE meant, personal protective equipment, and what things to avoid when performing the ghusl. So Shaykh Abu Isa, alhamdulillah, I think it was Wednesday or Thursday, he recorded the video. We had a very long conversation before recording the video. He had lots of conversation with Mufti Zubair before recording the video. And then after the video was recorded, we've looked at the video and edited it slightly to ensure that everything was correct according to national and international guidance. And I think that has helped a lot of people. I'm seeing lots of comments coming through here as well, and nationally, that people have found that extremely useful.
Very good. Very good. Just two questions here. One, I think they're both sort of focused. Well, I suppose one of them is. Let me try with this one with Muhammad Omer regarding some of the facilities that we have in terms of sanitizing some of these facilities where we're doing ghusl. What's your recommendation? Because there's a bit of difference opinion here. So you're using alcohol-based sanitizer to sanitize the ghusl facility. People are thinking about using bleach and mixing looses of sort of different types of liquids and formulating their own soap. mixtures and things like that. Is there any guidance on this? What should we be using in these facilities?
Yeah, we normally used to use BioGuard, which is very well hospital grade disinfectant, really. But unfortunately, that's not available. So we are using.
You're talking to an international audience here, by the way. So
yeah. So we are just using bleach, mixing it with water, or we're using disinfectant as you normally get, like Dettol or something equivalent to it. And then we're just using any other sanitizers which we can get for the door handles. And that's all we're using at the moment, right? Including on the floor. But the main thing is to disinfect the entire places which you would come in contact with yourself, either through hands or through the body or something else. So to make sure that all that area is sanitized. And also the most important thing is that when you're taking off your PPE, you have to make sure that you take it out in the right order, or else you'll be infecting. And one of the things which we are very, very conscious of, people should never touch a body without their gloves. That's so important. Sometimes people just forget that, and then they'll rub their hands on their face, which could become very infectious. So that's my particular guidance to you.
Going back to Mufti Zubair, it's another question here, and the question is really asking about the point that you raised earlier on regarding the person who's doing the ghusl, if you cannot find a mahram, non-mahram, whatever. So you cannot find a male a Muslim male to do the ghusl for a Muslim person who's passed away, and there is no mahram available, female mahram available. So we're resorting to non-Muslim men. Now you talked in the Hanafi fiqh, then that's an acceptable way to deal with it in that instance. Can you give us some kind of insight to some of the other people here who are not from the Hanafi madhab? Do you have any sort of understanding about that? I mean, number one, the question, I suppose the point here is it okay for them to actually go according to the Hanafi sort of approach, and that is to allow a non-Muslim to do the ghusl, or should they just avoid the ghusl on that basis?
Rahim. Well, for those schools that don't allow non-Muslim males to do the ghusl, they also wouldn't allow them to do tayammum either. Okay, so it'll be a case of either no ghusl, no tayammum, or following the Hanafi school. And for me, it will be easier to follow the Hanafi school and not do any ghusl and tayammum at all. However, I wouldn't be advising people, who particularly follow specific school, that you should follow the Hanafi school. It's not for me to do that. It's for them to contact their own scholars and ask them for their advice.
Okay, Shaykh Yunus, just a couple of points related to the grieving process. Clearly, there are many issues in terms of grieving in times like this. Are there any particular bits of advice that you can give people? You deal with this, you're dealing with this, aren't you, in the hospitals, and you're seeing the kind of situations that are arising with individuals. They're not allowed to touch their deceased, and sometimes, that comfort of actually being there at the last moment, touching them, holding them, these things are not really possible. So on that basis, what advice would you give? Some kind of Islamic spiritual advice that you would give to those individuals in such situations where they feel not only are they sort of mourning, but they're also feeling like there's something really missing in the process of what's happening.
I think we're living in very, very difficult times, unprecedented. And it's not only happening in the Muslim community, it's happening with every single community. What I would say to those individuals who are losing their loved ones and they're not able to attend, is that my background noise, or is it someone else?
Somebody's background sound there.
Yeah. Okay. So I think from a Muslim perspective, for those people who are losing loved ones alone in the hospital, or they are not able to attend the ghusl and the funeral, I would say this to them, that remember, our relationship in the hereafter might be very different to what it is here today. That, as the Quran mentions, that a son will run away from the father, the mother will run away from the daughter. So our relationship in the hereafter might be totally different. What we have to seek solace from is that as long as our loved one meets Allah in a happy state, that is what we should be trying to comfort ourselves with. Physically, we might not have been there, but spiritually, we can help our loved one by reading Quran, by making du'as, by giving sadaqah on their behalf. Because yes, we have this physical connection, and that's natural for every single human being. You might have spent 50 years with your wife or your husband. You might have been with your father for 30 years, 40 years, and suddenly you're not able to say goodbye. So obviously it's going to affect people, but we've got to put the spectacles of the Quran and Hadith and look at everything from the Quran and Hadith. And remember that the person who is successful, it might seem like, oh, this person died lonely, or this person was buried lonely, but Allahu Akbar, inshallah, when they go in the grave, and if they are successful, trust me, they are not lonely. They are not lonely. And that's what we should be thinking about. Positive thoughts about our parents, about our loved ones who have gone. That boy, the 13-year-old Muslim, he died alone in the hospital. He died, and then his janaza, according to reports, his family members weren't able to attend. But I say to them that child is in Jannah. And inshallah, we will also join him in Jannah. And I think that's what we need to focus on. And there are also organizations that are supporting mental health issues. The MCB on their website has a list of organizations that you can contact, which are supporting people to go through this grief and have someone to speak to.
Jazakallah khair. Mufti Zubair, one bit of advice for the ulama and the imams.
I don't think it's my position to give advice, but as a colleague, I would just offer counsel, if that's not any different, that please ensure that when you are advising your communities, that you are basing your knowledge on, or you're basing your advice on sound knowledge. Don't be hasty in giving your advice until you are satisfied that you have turned over every leaf to come to the reality of the situation, and then you advise your community. If you do that, inshallah, the advice will be sound, it will be credible, it will last us the test of time. I've seen a lot of fatwas that are way off the mark and they totally, contradict all the science that is available out there, and it's just, and a lot of it has been done in haste. Unfortunately, there has been some kind of let me get up my fatwa out first kind of an attitude. Everything we say, or everything we write, everything step we make, we will have to answer for that on the day of judgment. And as I remember from my studies, you know, it's like a bridge that you have to cross. You have to cross, and each time you give a fatwa, each time you give a position, each time you give that advice, you present yourself on the fire of hell that goes over the or the bridge that goes over the fire of hell. You present yourself to that, and then you give your position. Inshallah, we do that. Inshallah, our judgment, inshallah, will last the test of time.
Okay, and Muhammad, if you want to just give us a bit of advice, more specifically for the funeral services. I think your audio is off. Yeah.
Okay. If you are able to give ghusl, please try and give a ghusl if you possibly can. Be careful, take your precautions, but please, if you are able to do so, do give ghusl. The other only advice I would say, when you are giving ghusl, please, I just saw a question that somebody uses a hoist to lift the body. That is really not recommended at all. That you are going to create so much problem. So please try and follow the procedures and try and make sure that you do that in a safe manner so that you can give ghusl to everybody concerned. The only other bit I would like to give advice is that people who are even funeral directors are actually giving stories out which are scaring people. Please, do not give information which is not authentic, which cannot be substantiated, and try and create fear amongst the people. I think that's not doing a good service to the community at all. And we should really be very responsible. But the most important thing is that we should be absolutely 100% sure that we should not be going to places, even cemeteries or anywhere else. If we are infected, we should be staying home, and we should always be making sure that the social distancing is most important. If we do not face this, if we do not adhere to this guidance, I'm very sorry to say that the numbers of fatalities will increase. And that is something which we should try and avoid at all costs. That's the only advice I would give.
Okay, just one final point, and I'll open this to Shaykh Yunus. There's been certain individuals and people who have been sort of talking about the responsibility of the masajid in issues like this. For example, some masajid have locked down, closed down, a bit later than others. So there's been a lot of media press about this amongst people. A lot of people have been talking about this. So let's just clear the air here. So Shaykh Yunus, can you just mention 1 or 2 points related to that issue?
Yeah, so I think in terms of mosques, I think alhamdulillah, majority of the mosques, if not all the mosques in the country, are being responsible and following the government guidelines of not opening the mosques. Maybe a few workers are going in and they're doing the salah, and that's permissible. And the other thing which people have raised concerns about is, are the mosques that are opening their ghusl facilities, are they going to be legally responsible if one of their workers or volunteers becomes sick and maybe becomes very sick, etc., etc.? I think, look, the risk is out there for everybody. We've had 5 doctors who have died, Muslim doctors. We've had 1 Muslim nurse that has died. Who is responsible? It's a risk that we have to take to try and fulfill the right of the living and making sure that they live. Similarly, there's a right to the dead, and the dead we have a right, responsibility to fulfill that obligation of doing the ghusl. However, we always stress that a risk assessment should be done, and the risk assessment is based upon the Public Health England guidelines and the World Health Organization guidelines. And as long as the risk assessment is done, and that's why we say we're not asking for all the mosques to open up their facilities and do the ghusl however they want to know. What we're saying is that in one town, you get all the mosques together and you decide we have 1, 2, 3 facilities that can fulfill the guidance. We can have the PPE and we can give the training. And then once that is all done, that's the risk assessment, do the risk assessment and then allow people to do it. And then if they get ill, this is the will of Allah subhanahu wa ta'ala. We can get ill on the street. I mean, Boris Johnson has been giving everyday press conferences, and he got ill. And now, just whilst we're sitting here, we're hearing that he's been taken to hospital. Okay, and so everybody is at risk, and we just need to assess the risk, follow the guidelines, and if anything happens, this is the will of Allah subhanahu wa ta'ala. So as long as the risk assessment is done by the masjid, they will not be legally responsible as far as I am aware.
Okay, Jazakumullah khair, that's quite clear. So risk assessment is an essential part here. Okay, so I want to commend and thank all the panelists. Alhamdulillah, it's been very, very useful. I'm sure we've pulled out some very clear guidelines and understanding about some of these very, very important issues. Recognizing there's a real essence of spirituality that is required in matters like this, and we need to continue to make dua to Allah subhanahu wa ta'ala, turn to Allah subhanahu wa ta'ala, repent to Allah subhanahu wa ta'ala for our sins, because this is a very important sabab. This is a very important means of relieving us of these burdens that we're undergoing at the moment. This is a test from Allah subhanahu wa ta'ala, and we need to succeed in this test on the basis that we turn back to Allah subhanahu wa ta'ala and work to better ourselves, and this is a means of how this will be removed. Jazakum Allah khair for the audience. There's been many people here, alhamdulillah, and hopefully we can send some of these clear messages out there. Those of you, I just want to reiterate one point, because somebody's just sort of privately messaged me, and we recognize that certain individuals, they may have joined a funeral service, they've taken some advice from certain ulama, and clearly that was because of the messages that were out there at that time. There were certain guidelines that were out there, and certain procedures were performed in many different ways. But at the end of the day, as long as you sought advice from somebody who you trusted, and that person was somebody of knowledge, and that person advised you appropriately, then inshallah Allah subhanahu wa ta'ala will accept. You know, I wouldn't worry about those things. The more important things are that you now, you know, make dua for that individual that's passed away. And inshallah, you know, Allah subhanahu wa ta'ala place nur and barakah into their graves. So, jazakumullah khair. Finally, and thank you very much for everybody. There are still many other courses still yet. We've got a few more sessions going. So, inshallah, please, if you haven't already, join the Al-Balagh's sessions. And inshallah, we'll be talking about many other things as time goes on. And we turn to Allah subhanahu wa ta'ala, we ask for his forgiveness. Jazakumullah khair. Assalamu alaikum wa rahmatullahi wa barakatuh.